My name is Dr. Joe Pojman. I'm the Executive Director of Texas Alliance for Life. Welcome to our second quarterly Leadership Circle Luncheon of 2020. This is the first time we are meeting entirely online due to the circumstances. And we hope all of you and your families are safe and well during this terrible COVID-19 pandemic. For those of you who have been affected in especially negative ways, perhaps with loved ones fighting the infection or who have even lost their lives, we offer our prayers for healing and sincerest condolences for your loss. This has indeed been an unprecedented time for us all. Our Leadership Circle is a special way for individuals, organizations, it's for a donation of between $1,200 and $10,000 a year. If you're interested, 270 members who are helping us move mountains with their support. Visit our website at Texas Alliance for Life. Our teams have been up to. That was the primary elections in Texas. Texas Alliance for Life has made more than 120 endorsements, and our endorsed candidates generally did very well. Our 17 contested federal races, our success rate was 82%. In 23 contested state races, we had a 70% success rate. Effective political action can be extremely expensive to make an impact. Thank you to all who have contributed to our PAC. We've used your support to reach hundreds of thousands of voters through our voters guide. We've been told that the endorsement of Texas Alliance for Life is one of the most coveted in the Texas Capitol. Don't get too comfortable. Many of those candidates now face a runoff elections in July, and the general election in November is huge. Control of the Texas House, the US House and Senate, and the presidency are all in play. The inevitable Supreme Court justice appointees are at stake. Pro-abortion PACs are threatening to pour tens of millions of dollars of out-of-state money into Texas to defeat our candidates and elect a pro-abortion president. A president who will nominate only justices who affirm, not overturn, Roe v. Wade. We cannot let that happen. We are grateful that our president, Donald Trump, has done a stellar job of nominating federal judges, especially Supreme Court justices, who are willing to take a fresh look at the terrible precedent of Roe v. Wade and Planned Parenthood v. Casey. In early March, some of our board and staff traveled with me to Washington, D.C. for the Supreme Court's oral arguments in an abortion-related case out of Louisiana. That case, June Medical Services v. G, involves a pro-life safety regulation for abortion facilities. Two questions. Can a state require a safety regulation that arguably will not prevent performing abortions? Two, can abortion providers claiming to represent their clients sue to strike down a safety regulation that benefits the health and safety of women seeking abortions? It was fascinating to sit in the courtroom as attorneys for both sides made their arguments and bantered with the justices, hopefully giving us hints as to what they're thinking. The Supreme Court is expected to rule before the end of the term in late June. We also got to meet with several congressional offices and key pro-life leaders at national organizations. Our state and nation are immersed in a crisis like we have not experienced in anyone's memory, the coronavirus. On March 22nd, 2020, pro-life Governor Greg Abbott issued Executive Order 9 to delay non-emergency medical procedures and surgeries for 30 days. His goal was to conserve hospital beds and personal protective equipment for doctors and nurses treating the possible huge wave of patients with COVID-19. The next day, Attorney General Ken Paxton clarified that the order included non-emergency abortions. No one reasonably contested that a 1-month delay was necessary. The impending disaster from the pandemic was frightening, as already patients in the nation of Italy, and in New York City were dying for lack of treatment as some hospitals were completely overwhelmed and alarming numbers of healthcare workers were contracting the virus. However, abortion providers in Texas were not content. Planned Parenthood and Whole Women's Health led a coalition of 15 of the 25 abortion facilities who demanded to be treated differently. They wanted to be treated differently than all other non-emergency medical providers in Texas and conduct business as usual with no delay in abortions whatsoever, even if it meant putting the health and safety of doctors and nurses in hospitals and their patients at risk by using precious PPE and possibly exposing their own abortion facility staff and clients to COVID-19. They sued the governor in federal district court in Austin to be allowed to perform any and all abortions. That demand was granted by federal judge Lee Yackel, first for all abortions, and then only for drug-induced RU46 abortions and abortions late in pregnancy that would be impossible because of the delay. How big is that risk at abortion facilities? Well, 20 Planned Parenthood employees in Austin sent a letter to the CEO of Planned Parenthood Greater Texas with serious grievances about being compelled to treat clients possibly with COVID-19. KXAN TV in Austin reported that one worker complained there was not enough PPE at their facilities. Workers were being forced to do non-essential work for patients in person, and they were not being offered paid sick leave if they came down with COVID-19 symptoms. By the way, those 20 employees were abruptly fired. Amazing. Meanwhile, Attorney General Ken Paxton and his legal team aggressively sought intervention from the Fifth Circuit Court of Appeals, asking for a writ of mandamus, an extraordinarily and extremely rare legal procedure in federal courts. You may have seen me interview General Paxton here several weeks ago. The bottom line is that the Fifth Circuit granted the writ of mandamus and ordered Judge Yackel to delay all abortions, surgical and drug-induced, except a handful that would not be possible because of the delay. Meanwhile, many abortion providers appeared to violate the order and perform large numbers of abortions when those should have been delayed. We are addressing that issue now. Fortunately, in Texas, we have not seen a huge crisis as in other states. Governor Abbott's strategy is working. More recently, he issued a new order that offers increased options for medical professionals to perform surgeries and procedures in Texas while still protecting PPE and keeping hospital capacity in mind. The new guidelines allow medical providers to resume procedures and surgeries if they certify that they do not use excessive PPE. It appears that all women providers in Texas have done the certification and have resumed abortions. Nevertheless, we applaud the decisive action of Governor Abbott to mitigate the spread of COVID-19 in Texas by requiring that the non-emergency surgeries and medical procedures be delayed several weeks. That strategy has worked. We're grateful that deaths from COVID-19 in Texas are relatively low compared to those seen in other large states. And hospital emergency rooms continue to have ample capacity to treat patients. We believe that Governor Abbott's actions have protected the public and especially healthcare workers from the coronavirus. Now, our special guest speaker is State Senator Dawn Buckingham, representing District 24, which includes Southwest Travis County, Temple, Kerrville, Abilene. It's a huge swath of the state. Making history in 2016 as the first woman ever elected to represent Senate District 14, Dr. Buckingham is a physician who has been a strong ally of ours defending life. It is my honor to welcome Dr. Dawn Buckingham.